Hello and welcome to PCR London Valves 2024. I'm Philipp Lurz from Mainz and I'm delighted to be here with Tiffany Patterson from St. Thomas Hospital. What we would like to discuss today is the complexity of patients having not only one valve problem but having multivalvular disease. What's a typical scenario you encounter in your daily practice?
Yeah, it is a big problem for us. We often find that we have patients with multiple valve pathologies, the most dominant being AS, moderate to severe aortic stenosis, and probably moderate to severe functional mitral regurgitation, often presenting with heart failure symptoms. And it's really just trying to work out which is the predominant pathology, which we should treat first, and what happens to each valve depending on what the treatment is.
So in that scenario, what would you normally treat first, aortic stenosis or mitral regurg?
Again, it depends on the pathology of the mitral regurgitation, but on balance, if there is at least moderate to severe aortic stenosis, we tend to treat the aortic valve first and then review the mitral, because there's often a lot of release of LV afterload, and it's the potential to improve the mitral regurgitation. If of course it's degenerative, that doesn't tend to improve, so we then tend to plan for further procedures. I know some tend to do two procedures in one case, but we tend to fix them with the aortic first with a view to mitral later.
Yeah, I totally agree. And then the other common scenario is having both mitral regurg and tricuspid regurg, and one would think and also hope that if you fix MR, then TR goes away, but we actually know from studies that only happens in 1 out of 4 patients. But I guess we have one great advantage as compared to surgery. We can do it in a sequential way, and that helps a little bit in decision making. Do minimal invasive, but transcatheter means mitral first, and then see whether TR improves, and if it doesn't, then do a second procedure. It remains complex. What do you think is still lacking to improve the treatment of patients with multivalvular disease?
Well, it's challenging, isn't it? Because we have to discuss all these patients in a heart team meeting. It's not a straightforward decision. We don't have the data there necessarily in terms of how we should treat them, what order. We don't have enough data. I think really what comes down to it is that we should discuss them on an individual basis, and it should be treatment specific to the patient. So we take each patient individually and plan the treatment from there.
I couldn't agree more. So it's obvious multivalvular disease is a very common problem. There's much more learning which needs to be done, but the key for success will be bringing together different disciplines, certainly cardiac surgery, imaging, and discussing these patients, as you said, on an individual basis. Thank you very much for watching.